A popular actress is advocating for yearly mammograms. A screening, she says, caught her breast cancer very early. Dr. Nina Tamirisa with MD Anderson Cancer Center joins us now to talk more about it. Welcome and thanks for being here.
Thank you for having me.
And we're talking about Boy Meets World star Danielle Fishel, and she says that she got a reminder of her mammogram, so she scheduled it and then was diagnosed with stage 0 breast cancer. We don't hear that very often at stage 0, right?
Yes, yeah. So what she has is something called ductal carcinoma in situ. So you can think of the ducts in the breast as kind of like pipes running through the breast through which milk travels. And so when there's an abnormal proliferation of cells within the duct but haven't broken free from it and spread to the breast or beyond, that's called in situ. And so that's the earliest stage of breast cancer you can have. We call that stage 0. It's associated with excellent outcomes when treated.
Oh, that is huge. Is this just a really important reminder? I feel like that's why she's speaking out about it, talking about something very similar, you know, very personal to her, so that we can all try to make sure that we do those annual screenings.
Yes, exactly. I think sharing one story is always a difficult thing to do, but when stories are shared, it really helps other women. It provides someone to relate to, and then sharing so early on in the process helps remind women to schedule those mammograms.
And she didn't have any symptoms, like you said. Most people with this early stage wouldn't. But once it starts to advance just a little bit, what would some of those warning signs be that you want women to really watch out for?
So it is highly unusual for any kind of ductal carcinoma in situ to be able to be felt or have any symptoms from it. But you know, we encourage women to do their own self-breast exam and get their mammograms to be able to identify any new masses or lumps, any abnormal discharge from the nipple. Those sorts of things kind of are signs of something more brewing.
And who would be more at risk for a cancer like this?
So generally, there are some risk factors that are not modifiable. Increasing age is one of those things. And then consumption of alcohol increases the risk of breast cancer. And so, you know, mostly 1 in 8 women, the statistics show, will get breast cancer. So, and anyone who has a genetic predisposition as well is at increased risk.
Yeah, and we take a look at the list there, and I mean, there are some lifestyle things that we can do to help. Like if you're obese, try to lose weight. If you, when we talk about alcohol consumption at the very bottom, how much are you talking about that you really want women to consider? Because I feel like if you're having a glass of wine every night, you may think that's okay, but not necessarily if you're trying to prevent breast cancer,
that's
right?
That's true. That's true. So, you know, no alcohol is ideal, but yeah, I don't think there's any set number of how much you can have per week, but to try to limit the intake as much as possible.
And then does it go back to the old-fashioned diet and exercise for our overall health can help prevent breast cancer as well?
Certainly, certainly. We do see a link between obesity and other types of cancers as well, so it's really important to maintain your health and maintain exercise as well.
All right, well, thank you for taking time from MD Anderson Cancer Center to come talk to us about this. It's such an important conversation and a reminder outside the month of October when we talk about it so much, right?
Yes,
Good to see you here.
Thank you for having me.